Today we will learn common same-day surgery coding procedures related to hip. In this session, first we will see hip anatomy. As if you want to work or if you want to code a surgery charts, you need to understand the anatomy first. So in order to going to learn hip common outpatient procedure, we will learn the hip anatomy first. So here is the hip joint. So basically hip joint is a ball and socket synovial joint like a shoulder. So hip joint is designed for stability and weight bearing. So as all of us know, most of our weight is guided by hips. In hip joint, head of the femur meets acetabulum. So this is the head of the femur. So here is the acetabulum. Okay. So basically hip joint constitutes a joint between acetabulum and femoral head. Okay. So next, in hip joint we have ligaments also. So these ligaments will be helpful for stability. So we have two types of ligaments in hip. First one is intracapsular and next one is extracapsular ligament. So these are the hip ligaments. First we have extracapsular ligament. So what are extracapsular ligament? Iliofemoral, pubofemoral as well as ischiofemoral. Okay. Basically iliofemoral ligament is a Y-shaped and which will prevent hyperextension. And it is a strongest extracapsular ligament. So this is the iliofemoral ligament. Okay. So this is the Y-shaped ligament and it will prevent hyperextension of the hip joint. Okay. Among three extracapsular ligaments, this iliofemoral ligament is the strongest ligament. Okay. Next we have pubofemoral. So this is the pubofemoral ligament. Okay. So pubofemoral ligament is having the shape of a triangle. Okay. So which will prevent abduction as well as extension. Okay. Next we have ischiofemoral. Okay. So ischiofemoral ligament is the spiral and which will hold femoral head in the acetabulum and prevents hyperextension. So this is the ligament of head of femur. Okay. So ischiofemoral ligament which will provide or which will hold femoral head in the acetabulum. And we have next one intracapsular ligament which is the ligament of the head of femur. So which encloses in a branch of arbitrator artery. So this is the ligament of head of femur. So as it is inside the hip capsule, we will call it as intracapsule or intracapsular ligament of hip. So what is important here? We have three types of extracapsular ligaments and one intracapsular ligament in the knee joint or hip joint. So not its knee. So basically it is a hip joint. Sorry for that. Next, while coding, mostly we will observe two types of hip lesions. Okay. First one is pincer lesion. Next one is cam lesion. Okay. So here is the pincer lesion. Okay. Abnormal bony growth on the acetabulum is called as pincer lesion. Okay. Abnormal bony growth on the head of the femur is called as cam lesion. Okay. So we have multiple codes for these pincer as well as cam lesions. We will see those codes soon. So what is pincer impingement? So extra bone extend out over the normal rim of the acetabulum. So this is the pincer lesion. So basically this pincer lesion is the abnormal or extended bone of the acetabulum. Okay. So sometimes the labrum can be crushed under this pincer lesion. Okay. So next we have cam impingement. Okay. So femoral head is not round and can't rotate smoothly inside the acetabulum. So because of this cam lesion. Okay. So that is the form of cam impingement. Okay. Sometimes in the operative report you may see both pincer as well as cam lesions. So this is the pincer lesion which is on the acetabulum, cam lesion on the femoral head and combined pincer and cam where patient will have both acetabular pincer lesion as well as femoral head cam lesion. Okay. So in the operative report, if you see the term FAI, so FAI means femoroacetabular impingement, means patient is having both combination of pincer as well as cam lesions. Next we will see common hip procedures using the CPT codes. First one is hemiarthroplasty of the hip. Okay. So what is hemi basically? Hemi means half. Arthroplasty means joint replacement. So here physician will perform replacement of one component of the hip. So that one we will call it as hemiarthroplasty. Okay. For example, if you see this one, partial hip replacement. Okay. So physician will replace only one part, either acetabulum or this femoral. Okay. In total hip replacement, physician will replace both femoral head as well as acetabulum. Okay. So basically this is the cup of the acetabulum. Okay. So here you need to remember arthroplasty includes replacement of both femoral component as well as acetabular component. In the partial hip replacement, physician may replace any one component, either acetabular or femoral. If the physician replaces both components, acetabular and femoral, you will call it as total hip replacement. So first we have the code 27125, hemiarthroplasty hip partial. Okay, partial means physician will replace only one component, either acetabular component or femoral component. Okay, so based on your facility guidelines, we need to use C1776 into 1 for the implant. Okay, next, liner is not considered a component for knee or hip replacement. Okay, so bipolar arthroplasty replaces only the damaged ball, femoral head. So this one. So this is the femur. So physician will remove this femoral head only in the bipolar arthroplasty. Okay. And this hemiarthroplasty is for the initial replacement of the native bone, not for revisions, as we have separate set of codes for revision. As we have discussed previously, now we have one code, most common code 27130, total hip arthroplasty. In the operative report, mostly we will see it as THA. Okay, where physician will replace acetabular component as well as femoral component. Okay, so this is the acetabular and femoral components. Okay, so here also polyethylene liner is not considered a component. So here just you need to consider acetabular component as well as femoral components. These are the two components mostly suits for hip replacement surgery. Okay, hip resurfacing is considered a variant of THA. Okay, so hip resurfacing one type of THA, means total hip arthroplasty variant. Okay, so like partial hip arthroplasty or hemi arthroplasty, THA is also the initial replacement of native bones. Okay, not revision. Next we have codes for revision to total hip arthroplasty. So 27132, conversion of previous hip surgery to total hip arthroplasty with or without autograft or allograft. Okay, if you want to code 27132, documentation must and should have previous hip surgery. Okay, so what are the common hip surgeries? If the patient had previous hemiarthroplasty or any other surgery like fracture repair. Okay, so if the hemiarthroplasty or fracture repair are unsuccessful, patient may convert into total hip arthroplasty. So that time you need to use 27132. So basically documentation you need to check whether patient is having previous hip surgery or not. So you can use 27132, the patient is having previous hip surgery. Otherwise you can't code this code. Okay, 27134, revision of total hip arthroplasty, both components with or without autograft or allograft. So what are both components? Please mention in the comment section of this video. Okay, so 27137, revision of total hip arthroplasty acetabular, only this component. So physician will replace or revise this component. Okay, 27138, revision of total hip arthroplasty femoral component. Okay, So 27137 only acetabular component revision. 27138 revision of total hip arthroplasty femoral component. Simple. So we have few questions. So here, how do we code these scenarios? So patient had previous hemiarthroplasty. Now physician is converting into total hip arthroplasty. How do we code this scenario? Yes, here we can code 27132 as 27132 is for conversion of previous hip surgery to total hip arthroplasty with or without autograft or allograft. So during the conversion, physician will remove old hardware. Okay, so that time removal of this hardware you will not code, which is included in the major procedure, which is conversion of previous hip surgery into total hip arthroplasty. So just what is keyword here? You can't code removal of the hardware. So next scenario. So patient had previous history of total hip arthroplasty right side. Okay. So now patient came in with osteoarthritis as well as polyethylene liner wear. So in current visit, physician has washed the components of the hip arthroplasty and the new liner was placed using the impactor and mallet. And also along with that, physician has replaced the femoral head. So how do we code this scenario? So basically here physician has replaced polyethylene liner as well as femoral head. So in this case, we will use 27138. Revision of total hip arthroplasty, femoral component only, with or without allograft for the revision arthroplasty. Why means, as we have discussed, polyethylene liner is not a component of hip replacement. So in the hip replacement, we have only two components, acetabular component as well as femoral component. So polyethylene liner is not considered as a component of hip arthroplasty. So that's why we will not consider polyethylene liner replacement for coding. So but we need to code for femoral head replacement using 27138. And as we discussed previously, polyethylene liner replacement is included in the major procedure, which is replacement of femoral head or revision of total hip arthroplasty femoral component. Next we will see hip arthroscopy codes. So far we have learned all open procedures related to hip joint. Now we will see few hip arthroscopy codes. 29860 arthroscopy hip diagnostic with or without synovial biopsy. It is a separate procedure. So means you can't use this code along with any other major arthroscopic procedure on the hip area. Okay. So what is synovial biopsy here? So in the documentation, you need to see the keywords like this. Due to the patient's history of psoriasis, a biopsy of the synovium was taken using the grasper. This was sent for pathologic analysis to rule out inflammatory arthritis. Okay. So this is the purpose of synovial biopsy. Okay. Next we have 29861 arthroscopy hip surgical with removal of loose body or foreign body. Okay. So based on endoscopy or arthroscopy coding guidelines, if the foreign body is equal to or larger than the diameter of the arthroscopic cannula, and also in order to remove that foreign body, if the physician will use the larger than the standard cannula size, or if the physician performs separate incision, so you need to code it separately. Okay. So if the foreign body size is less than the cannula size, you don't need to code it separately, or loose body removal separately. So basically, in order to remove the loose body, if the physician uses separate incision, you can code separately. Okay. If the physician enlarges the portal, you can code loose body removal separately. Other than that, you can't code loose body removal separately. Next we have 29862 arthroscopy hip surgical with debridement shaving of articular cartilage, abrasion arthroplasty under resection of labrum. Okay. So basically either chondroplasty, repair of the articular cartilage of the hip joint, where physician will perform debridement or shaving. Okay. 29863 arthroscopy hip surgical with synovectomy. Okay. So if the physician performs excision of the synovium, you need to code this one. So basically we don't have any code for partial synovectomy or complete synovectomy. The documentation partial contains partial also, you need to use 29863. The documentation contains complete synovectomy also, we need to use 29863. Okay, and in the documentation if we see arthroscopic trochanteric bursectomy as well as arthroscopic IT band release. We don't have any separate set of codes, you need to use 29999. So the documentation contains arthroscopic trochanteric bursectomy, you need to use 29999. The documentation contains arthroscopic IT band release, you need to use 2999. So IT band means iliotibial band release. So if anyone looking for medical coding jobs in UAE, USA and India, please join in WhatsApp group. Group link is the description of this video. Okay, and also our trainings include surgery coding training, IPDRG coding training, SEC coding training and CCS certification training. And also you can send WhatsApp message to 707-526-3939. So next one, how do we code arthroscopic iliopsoas tendon release and an iliopsoas tendon debridement in the hip? So basically we don't have any code for release and debridement of iliopsoas tendon using the arthroscopic approach. So you need to use unlisted code 29999. So this is the iliopsoas muscle. Okay, so this is the impingement on the hip. Next we have hip arthroscopy codes 29914. Arthroscopy hip surgical with femoroplasty, treatment of cam lesion. Stapyloplasty, treatment of pincer lesion. 29916 with labral repair, means stapler labral repair. Okay, so as we have discussed, cam lesion is related to femoroplasty or femur. Okay, pincer lesion is related to acetabulum, so stapyloplasty. So whenever you want to code these two procedures, based on the documentation you need to code whether lesion is on the femur or acetabulum. If it is on the femur, you need to code it as cam lesion, femoroplasty. If it is on the acetabulum, you need to code it as acetabuloplasty or pincer lesion. Okay, if the patient performs labral repair, 29916. Okay, so if you see the parenthetical notes here, do not report 29916 in conjunction with 29915, 29862 and 29863. Okay, so because the reconstructive procedures described by codes 29914 to 29916 also involve articular cartilage and labrum, procedurally it is not appropriate to report either code 862 or 863 in addition to codes. Okay, so what are those codes? 862 is like loose body removal, 863 is synovectomy. So along with these major procedures, we will not call loose body removal as well as synovectomy. So 29862 is for abrasion arthroplasty or chondroplasty. So 29863 is for arthroscopic synovectomy. So those codes we will not use along with 29914 to 29916. So for example, if we see iliotibial band lengthening or ITB lengthening. Okay, so if a surgeon performs an open ITB lengthening and a bursectomy, would it be appropriate to report code 27305 for the ITB lengthening? So what is the answer here? Yes, it would be appropriate to report code 27305 fasciotomy iliotibial open for an open ITB lengthening of the hip. Okay, so here you will not code bursectomy separately along with ITB lengthening. So thank you guys. Thanks for joining this session. So as usual, if you like this session, please click on like button, and also if anyone looking for surgery training, IPDRG training, SCC training or CCS certification, please send WhatsApp message to 707-526-3939.